on, and I'm so glad. I'm so glad that she's here. Like you said, when you ask us, you ask those questions, and we are not able to answer. So we have to get someone who's the professional, and that's what we did. But first of all, good evening, everyone, and welcome again to being a woman breast cancer support group. I also want to start by welcoming all of our new participants and the returning participant. We're grateful. We're very grateful that you're here. And this is a safe space, absolutely safe space. So, you share at your own comfort and your level. Okay. Uh, Again, as Terry mentioned, we are honored to have Miss Melissa Lynn. First, I want to apologize to those who joined tonight expecting our discussion on financial resources with Miss Pam. We will reschedule that session so you still receive the information and the support you were looking for. Or I am happy to email that information out to you. But Miss Melissa will be sharing her expertise and answering several of the questions many of you submitted during registration. So, to respect everyone's time and without further ado, please welcome Miss Melissa.
Thank you so much, and thank you for the invitation to chat with you guys tonight. Um, and like they said in the introduction, I'm an oncology nurse navigator. I lead our team at UF Health. Of course, we're specialized in breast cancer, but we also navigate cancer care for gastroenterology cancer patients, gynecological cancer patients, melanoma, sarcoma and lung cancer. And we're looking to expand that group to also take care of some bladder cancer patients and potentially brain mets. And most of this group probably knows that's one of the most common metastases for breast cancer. So we're super excited to start developing our brain metastases program at UF. So I'm going to share my screen just for a quick second. Oh, I think I had to send a request to share. I think it's going to work now. Let me just make this bigger. Okay, so I just wanted to give a quick overview of kind of what we do. Many of you survivors or caregivers, maybe you've interacted with a navigator at some point in your journey. But we are cancer specialized registered nurses. We have to go through many years of training. And with us being a magnet designated hospital, we're also required to have specific certifications in oncology care after so many years of service. So we're registered nurses who help assist patients, their families, and caregivers navigate the complexities of the healthcare system. I say this to so many people that I encounter. I'm like, I have no idea how people can successfully navigate the healthcare system without having an advocate there to go along
Mhm.
this journey with them. It is so hard. I mean, I've seen it in my own family. I'm like, where would they be without me there advocating for them? So it is our goal in my program to expand to where we can offer this service for every single cancer patient because it's so needed. So common things that we help with, we serve as that main point of contact between the patient and their multidisciplinary care team. Sometimes, especially when you're initially going into the journey, it can be a little bit intimidating to kind of ask questions, especially in the beginning, because you haven't developed that rapport with your healthcare team. So we're there to help be that intermediary person to facilitate those conversations. We're working in the background to make sure all of your appointments and exams are with the appropriate providers in the appropriate sequence and happening as quickly as possible. We're following in the background just to make sure all of our patients are being compliant with their care, with their treatment plans, because we want you all to have the most successful outcomes with your cancer treatments. Our team is also really involved with our weekly multidisciplinary cancer conferences. And this is where the whole entire team meets including our oncology surgeons, radiation oncologists, medical oncologists, pathology, radiology, and the navigators. So we meet every week and discuss every new case and every post-operative case. And that's to ensure, we have all the disciplines at the table to ensure that we have developed the best and most evidence-based practice treatment plans for each patient. And then the navigator, it's our job to call the patient after those meetings just to say, hey, this is what we chatted about. This is the plan. Of course, most of the time it hasn't changed, but we just want to provide that reassurance to everybody that the whole care team is on the same page and kind of what the next steps are from there. Of course, we provide a lot of education throughout the cancer journey, what to expect, we answer questions about the disease process itself, results and treatments. I will say that we have a very, very specialized team. So we do rely heavily on our radiation oncology nurses to answer a lot of our radiation-based questions because they are there living in that environment every day. And I call them our ninjas. We have ninjas in radiation oncology and medical oncology. So we serve as that intermediary between the two, but we are there to make sure that you get your answers. We'll point you in the right direction. And our medical oncology nurses are great to provide education on all the different therapies. Oh my gosh, there are therapies for breast cancer changing every day, and they are by far the subject matter experts. Another job of ours is we connect patients to resources. So we work closely with our social workers. We have one specifically that focuses on breast cancer. And Miss Pam, she said I could actually share her contact info with you guys if that's something you would like to have. We help connect patients for clinical trial opportunities, support groups like we promote Miss Pam's organization. And we place referrals to other providers as needed as well. I think we kind of already talked about assisting with communication. Um, we're making sure that all of the doctors on the care team have everything they need to provide effective care. So we a lot of times will help get outside imaging if you've had it done outside of UF Health or if you've seen any providers outside of UF Health. My team and I can help gather all those things to make sure that the doctor has everything they need so you can have an effective visit and not have to come back. We also, some of our patients come from far, far away. And they wish to have some of their cancer treatments completed closer to their home. So we help communicate the treatment plan and share records with those outside providers as well. And then we serve as a resource for our community, just like what I'm doing now. We do community outreach events, and we serve as a main point of contact for community providers that need to get their patients into us for we do a lot of second opinions and things like that. Um, so I know there were lots of questions coming in about disability benefits for patients with breast cancer. And I can talk a little bit on that. I'm going to say I'm not the expert, but we do get this question quite often. So I'm just going to switch my screens just for a second. And
And
a
we
lot of
also and we also have another question too, after you talk
Yeah,
about
for
that one.
sure. I will try my best to answer all questions, but I promise Miss Pam, if we can't get to all the answers tonight, we will track somebody down and get those for you guys. So many of you have probably seen this website. It's the National Breast Cancer Foundation. They actually have a great article on disability benefits for breast cancer patients and things you need to know. And like I said, we can also share our breast cancer social work contact information. But the gist of it is, it's a little bit different depending on your situation. There's no straightforward answer to say, if you have breast cancer, you're going to automatically qualify for disability. It depends on the type of breast cancer, what stage it is, like its location in the body, if it's spread anywhere, if you've had any previous cancer treatments. Um, and of course you have to be incapacitated where you're not able to work too. So I don't know if that answers the questions regarding that. So it's a long of the short of it is it's a case by case for each patient's certain situation, and we're happy to help try to get any additional answers for you guys. Did you want to ask that question?
Yes. The other question is, are navigators provided to all cancer patients? And what resources are available to children of cancer patients?
Ooh, great questions. I think I touched on this a little bit in the very beginning. Right now, we don't have the capacity to touch every single cancer patient, but that is our goal. But I am very honored to say that we touch almost every single breast cancer patient that comes in the door. So every one of them, when they enter our system with a positive biopsy, we get them in to see the breast surgeons. That's just the starting point for us. We get them to see them as soon as possible. They'll do that initial consult, go over your pathology and all the potential treatment plans. Then we do that multidisciplinary tumor conference. And then going from there, it's a case by case as to what needs to be done. Somebody put in the chat, my mom is in law and has been working with her navigator. That is awesome. I love it. Yeah, if you guys ever have, if you're seeking care at UF or a family member or caregiver and you need help, please don't hesitate to reach out to us. I'm happy to help as much as we can. Children, in regards to that, I've always been on the adult oncology side, so I don't know a lot of that. But I can say I believe they do have navigators, but I don't know if there's a navigator for every single pediatric cancer patient. But they have quite a bit of hefty resources on their team.
Okay.
Uh, Let me ask. It's not so much as a pediatrics cancer, but the adult, their mother or father, who a mother who has been diagnosed with cancer. Are there resources for that child? You know,
Oh, I see
of
what you're
that
saying.
cancer patient.
I see what you're saying. Sorry, I missed that part of the question. Um, There are, and I will say I have this great book that one of the pharma reps made for this specific purpose. It is a beautifully narrated book that's specifically geared towards talking with your child about a cancer diagnosis. And it was specifically made for breast cancer patients, but can be used for any type of cancer. So one of the representatives is supposed to be actually bringing me some of those books. So Pam, once I get those, I'm happy to try to share them. So we have
Wonderful.
that, yeah, we have that resource, and our social workers work too to help provide guidance to the cancer patients and caregivers on how to relay sensitive information to kids based off their level of understanding and their age.
Okay.
Yeah.
And there's also uh, with our mass program, when we go out and educate about breast cancer, and we take the mobile unit, and when we educate, we go a lot of times we go into the most rural communities. Most we deal with a lot of women who are uninsured, you know, at that poverty level, So we get a lot of requests for funds during, is that something that the navigator can assist them with, providing them with those resources where they can submit a grant application, seek funding for, while they're on having their treatment.
So we provide every new cancer patient an information packet with so many valuable resources in it, and some of them are like the Susan G. Komen Foundation, and they often have a certain set amount of funds that they can help with. But our oncology social workers, Kristen and Nina here in the Medical Plaza, they are amazing. And they are the ones that stay on the up and up of all of these grant fundings. Because Miss Pam, you probably know better than I do. They open and close all the time. So
Yes.
it's hard to catch them. But the social workers also help our patients with Medicaid applications, Social Security disability
Mhm.
applications. So my navigators are so fortunate to have those ladies right there on site, and they do this every day. So we rely pretty heavily on them in that. But we at least know about what resources are out there.
Okay, wonderful. I know there's a lot of questions about those type of resources, and I just wanted to just say to any of the women who is seeking financial assistance, you need to have like all your paperwork ready, like
Mhm.
your because some of the things that they ask for, like the note, a doctor's note. Uh, you should have like a package ready, instead of trying to wait. They're going to ask for the same thing. They're going to ask
Yep.
for a diagnosis. Miss Melissa, can you speak on that? What they will ask for, and you should have this ready, uh, like your arsenal.
Yeah, I would say probably your pathology report, your most recent physician notes, which if you're a patient of UF Health, you can actually, it's pretty cool. If you're signed up for our MyChart portal, you can download those right on your phone. It's so convenient. They're going to want your most recent tax documents. We have a lot of, like Miss Pam said, we deal with a lot of low income rural areas that are uninsured, that have quite a bit of uninsured patients. So we do help navigate them to resources. UF Health also has a patient assistance program that we've had quite a few of our cancer patients qualify for. So definitely let us know if you have somebody who needs help. I know that Pam, you probably know it better than I do. The Florida Department of Health has a program to help with cervical and breast cancer screening.
Yes.
So we do work with them quite often too.
Yes, I know. Absolutely. We also have just to let you all know, this is, like I said, this was something that I was going to speak on. Uh, we have a fund. We have a Living Waters Breast Cancer Assistance Fund. We do have that, and the information that we just asked about that you need, if you have that, and you submit a application to us, and if you have all of that information, instead of us keep asking, you missing something, try to send everything at one time, because
Mhm.
when a person is in need of assistance, and I know it can get frustrating, you got to understand, I'm a 25-year survivor, so I know when I was submitting uh, all of this paperwork for assistance, and this was 25 years ago. Don't I look wonderful? but I'm just letting have this stuff ready. And I know, and then you don't have to get frustrated when they ask you to
Mhm.
send this or send that. They're going to ask you to send a copy of your a picture ID. Have
Mhm.
all that stuff ready, just in a folder. So when someone, because you're going to be applying to multiple people.
Multiple. Yep.
You're going
Yep.
to be applying to multiple organizations. And we have that too. So we ask for the same thing. So that's just something to relieve that stress. At least, and
Absolutely.
have somebody help you. You know, I'm
Mhm.
telling you, if you're in treatment, have someone submit that all of that application and all the necessary paperwork. So I just thought
Absolutely.
I would just chime in on that.
No, that's great, great advice. I absolutely echo every piece of that. And we'll just add that it's also good to bring those things to your appointments because you can sometimes go right that day and talk to an oncology social worker and they can help you on the spot. But if you don't have all those documents with you, it's just going to delay things. And with these grants opening and closing quickly, you got to catch them while you can. So 100% have all of those items with you to those appointments and just available at home as these opportunities arise because you'll be best prepared to take advantage of those. I did want to share that we work closely with the American Cancer Society too, and they have so many resources that I just wanted to share too. They, of course, have their 24/7 cancer helpline, but I wanted to point out that if it's so important to make sure when you're doing online research of your own that you're reaching out to evidence-based cancer information. So I tell
Mm-hmm.
patients you want to focus in on those .orgs or .edus. And ACS does a really good job about breaking down your diagnosis, survivorship during and after treatment. I know some of those questions were in there for tonight. And also, they do cancer education on specific treatments. Like if you were going to have a mastectomy, they have all kinds of literature out there on that. What to expect before, during, and after radiation. I think I accidentally closed out my email. Give me just a second. I want to show you some of those. Give me just a second here. I had saved a bunch of these really cool resources that we rely heavily on every day. We did the disability. Um, this is what I wanted. This is the American Cancer Society website. This is where, and I can share all these links with you guys too. This is the website where you would want to go to get a lot of that information that was in the questions submitted. Um, so there's cancer prevention and early detection, a bunch of stuff here that's good. Cancer fact sheets, which they have one specific on breast cancer. Um, Cancer patient and caregivers. And then down here towards the bottom, I wanted to focus in on cancer treatments. So there are PDF files for you to go in and look and learn about your surgery, radiation, chemo side effects. There's all kinds of immunotherapies out there which target a specific cancer mutation. Um, so we do a lot of additional testing at UF Health to see if you have a targetable mutation. So we would send a piece of your tissue off, and they look at that in the lab and see if you have any mutations caused from that cancer. And if so, there may be a targeted therapy that we could, it's like another arsenal in our toolkit to help with these cancer treatments. I know there was questions about hormone therapy for tonight. That's really common. Um, but there are some ladies out there that are hormone negative, like our triple negative breast cancer, one of the most aggressive types. That would
Explain
not
that, Melissa. Explain that though.
for
Uh,
sure. So triple negative means that your progesterone, your cancer is not being driven by a hormone such as progesterone or estrogen, and it also doesn't have the HER2 marker. I tell patients the best case scenario, they're all positive because everything that's positive, there's an extra treatment for it. So if you're estrogen or progesterone positive, that tells us that this cancer is being driven by hormones and that we can prescribe oral therapies to block those hormones so it's not feeding the cancer anymore. Oftentimes, if there's any delay in getting a breast cancer patient into surgery, we'll even get these started in the preoperative setting quite often. Um, and then post-operatively, if they hadn't already started on it, we would get them on that. And depending on what it is, it's average 5 to 10 years that they usually take those, depending on, what medication is selected. So yeah, these are great resources here. And I think we can even request, I don't know if you guys do a lot of community events. We can even request like paper copies of these booklets and worksheets too. Let's see what else I had. I had one other thing I just wanted to share. This is like probably the best arsenal in my toolbox. Every time I want to change a screen, I have to reshare, so my apologies.
it's okay.
All right, so this is called FindHelp, and we actually have this embedded into our electronic medical record, but anybody can just Google FindHelp, and it's so cool. So you can just say, I'm looking for a support group for breast cancer, and then your zip code. I'll just put in Gainesville. And then find programs. And it's going to search anything out there in that zip code that's potentially available. You can do this for food, housing, goods, transportation, help financial assistance, like any caregiver stuff, legal. I just can't, emphasize enough that this has been such a valuable tool for us to have access to. Um, yeah, do you guys have any questions about this? Like I said, you can find housing, food, help for transportation costs like bus passes or ride shares. Um, it's a really cool resource. Pam, have you guys seen this before?
I have never seen this, but we will. We're going to put this on our website.
Yes, yes, please
You
We
were
are
do.
going.
reading my mind.
Okay,
Yes.
we're going to put this on. You know what? What I wanted to ask you, I wanted to let you know. A lot of our people that's on, they're not just only in Florida.
Okay,
Okay.
that's good to know.
Yeah, so so just in case if you all don't know UF, y'all have to Google it, but we partner with them in the state of Florida. Uh, but this is wonderful. I like this. Is this fine help? Is this when you access this for anywhere?
Anywhere you can just type, I don't know if there's anybody on the call with another zip code, but yeah, you could put in any zip code, and it's my understanding because I am in a large network of oncology navigators throughout the United States, and we have a pretty heavy presence in Brazil as well, and we all use this. So it's like nationwide for sure.
Hmm.
And it's my understanding these are pretty well vetted. But yeah, I wanted to see if you guys are on here. If not, we need to get you added.
This is
This is,
awesome.
yes, this is wonderful.
Um, Peaceful
Wow.
Path is on there. Living Beyond Breast Cancer. Yeah, if not, we need to get you guys on here because you're super valuable to be added.
Absolutely.
Um,
And these all of these organizations that I've seen, these are a lot of organizations that I provide to uh, women who contact me. And here it is. All I can do is just now send them to this website.
you can send them
Mhm.
to the website, or if it's somebody that's not tech savvy, I know some of our more elderly patients struggle a
Right.
bit with the technology. You can go in here and just check off a few things here, and then you can actually like make a printout of these checked resources.
I love it.
Yeah.
Yeah, this is definitely going on our website. And
Yep.
I have a question for you. On one of the other documents, I saw
Sure.
the caregiver information.
Yes.
Um, how does
Yeah.
that work for, well, I'll explain it this way. My father was diagnosed with prostate cancer years ago. He's a survivor. And my mom, fighting my dad, trying to make sure that I was included on the doctor's appointments and all of that.
Mm-hmm.
That was a challenge. So, can you explain from a caregiver standpoint, what does that process look like from the time that a loved one is diagnosed? They share their diagnosis with you, because I know that we also have a caregiver on the line as well, on
Mm-hmm.
our call. What does that process look like in the oncology navigation process? How does that work?
That is a great question. And if we have somebody, I think most of our caregivers end up being family, but of course there are others out there that are friends. And a lot of times our cancer patients will decide to have them added as a contact that we're allowed to speak to in their electronic medical record and give us access to give them information. So that is the best place to start. That way, and of course the actual patient has to be comfortable doing that. And if so, that allows us to work with the caregiver and take some of that burden off the patient so we can kind of communicate with them in regards to appointments, like you said. Just those check-in, telephonic or in-person check-ins to make sure they both have all the resources they need. And if not, connect them with our oncology social workers or support groups like yourselves. So yeah, that's the best. I would say that's probably my best advice is to, if the patient's comfortable with it, to get them added for us to have permission to talk to them. That way the patient, a lot of our patients just don't feel like talking on the phone or, we could be able to work with the caregiver and take some of that burden off of them.
Great, thank you. And then we have another question. After about the eighth infusion for triple negative invasive cancer, what are some things you can do for energy levels?
Oh my goodness, great question. And I'm thinking that person receiving that therapy, was that prior to surgery? And if not, if that person's not on the call, it's or uncomfortable speaking, it's okay. I can just speak in
I'll speak.
generalities.
I'll speak.
Yeah,
So
okay, go ahead.
I'm CC, but my wife DJ, she has triple negative breast cancer. So I am a caregiver, and she has cancer. But so we are on about the eighth round of infusion, and the energy levels are like just dead. So
Yeah.
what are some natural things you can do to try to help bring that up? If there's
And this is big,
anything?
and she hasn't had surgery yet, correct?
No.
Okay. All
It's
right.
12 rounds before, then she's getting a double mastectomy,
Mm-hmm.
and then she'll have it afterwards. And then
Is she having like gastrointestinal side effects like nausea, vomiting, diarrhea, anything like that?
yes.
Yes.
All that. So I would say that's probably the best place to start is to next time you guys see her provider, um, just advocate for them to, and I'm sure they probably are checking her labs, just to check some labs, make sure she is not dehydrated. Sometimes just a fluid bolus can make these cancer patients feel so much better. If you feel like she is dehydrated and not eating and drinking or losing fluids from the GI tract, there's also you can do yourself though. You can buy bottles of IV. Oh my gosh, I'm losing my train of thought. It's just like IV fluids in a bottle you can drink. It's like oral IV therapy, and those are really high in electrolytes. What about food intake?
Um, we do Hello Fresh, so she pretty much she'll eat the food at nighttime, and like earlier, like she had like a maybe like a cup of oatmeal, but a lot of times, especially like so her infusions are on Tuesday. She actually goes to the VA clinic up there by UF.
Yeah,
And so usually on Tuesday she's not really all that hungry, not much
yeah,
appetite, but forcing the fluids or forcing ensures. But still, I mean, there's an appetite there, but it's not how it was previous.
got you. I know it's pretty interesting this is brought up because we just added an oncology dietitian to my program, so it might be good for her to the 7 to 8 o'clock hour is a little bit tough for a lot of my staff, but it would be awesome if she could pop on one day and chat about um, all of the dietary recommendations for folks with cancer because she does some pretty amazing talks. But I know she advises patients if they're not able to get their nutrition through the normal meals to supplement with a like an Ensure or a Boost. That way, you are making sure they get enough protein in because you need protein and glucose and some carbohydrates to build up that energy level. So I would think about fluids, a nutrition supplement, and then it is so hard when you're going through active therapy, but staying as active as possible really, really helps. So even if you can just get out and walk a little bit, our doctors tell patients this all the time. It's so hard, but you got to get out there and move because being sedentary, it's just going to make the fatigue worse a lot of times.
Okay. Thank you.
You're so welcome. Any other questions out there? I'm looking in the chat.
I like that oncology dietitian. I didn't know there was such a thing.
It's a
Okay.
so it's brand new. She's
I
only
would love
been,
to have one on.
yeah, she's brand new. She's only been on my team like a month and a half, 2 months now. And she, of course, can't touch every cancer patient, but her services are available to any of our patients on active therapy who have a nutritional concern. So, of course, our head and neck patients, they almost
Mm.
every one of them are struggling with getting adequate intake, having to get feeding tubes and certain things. Our gastrointestinal cancers, they're probably our second highest, especially like our pancreatic and gastric and esophageal patients. We work quite a bit with them. Breast is not super heavy, but we do get some like I think it was Miss Cece was saying with her loved one, where they need some extra support. So we pop over and see patients sitting right in the infusion chair and try to give them some advice.
Wow. You all are so helpful. I'm one of the ones that live in Georgia. So I'm sure our hospitals up here are great, but y'all are wonderful. So thank you for sharing that.
You are so welcome. Are you facing any struggles in the Georgia area with resources or anything that we might could help with? Give some advice?
I am not a cancer patient or caregiver at this time. We recently had a situation with my daughter. She was diagnosed, about 10, 12 days ago with an air pocket around her heart. So it's not
Hmm.
cancer related. And so we've been on the phone, with the hospital and trying to get her care. So, but a lot of the information that you shared, I've written down some notes, and that's going to help me kind of redirect where, we need to go to finish getting, extended care for her. So,
Got you. And of course, if you guys ever need second opinions, you can reach out to me and I can try to help facilitate second opinions at UF Health too.
okay.
I do that for a lot of patients, other doctors out in the community. We're there to help patients navigate to care. So,
Okay. Great.
and,
Does anyone have any other questions? And if you have a question, and you want me to turn off the recording, just say, hey, can you turn it off? And I'll be more than happy to.
Zeta put in the chat, how do I deal with a stubborn patient who does not follow neutropenic precautions as a caregiver? I'm trying to make sure I fully understand the question.
Hi, we're coming off mute. I'm here with my husband. It's our my mom-in-law, his mother. Do you want to ask your question?
Yeah, I was just gonna ask how to, like, what's a good way to, I guess, how to convince someone, or what's a good route to take when someone's not following, important safety precautions like neutropenic precautions when they're susceptible to get sick. So yeah, this is something that happens a lot with different aspects. So do you have any insight on that you can
Yeah,
help with?
yeah, for sure. So just to make sure I understand, you guys are someone you know is the patient, and then the caregivers are the ones not following the neutropenic precautions. Did I catch that right?
No, the patients themselves are.
Oh, the patients themselves are not.
Yes.
That is harder. Um, yeah, that is a great question. I would just sometimes it just requires re-educating them about the importance of it. Like, when their white count is, especially when their white counts are low, they're so susceptible to catching things. And when they are so run down from a lot of these therapies, they could have, worse outcomes from those. So I think maybe getting a nurse or a nurse case manager or a navigator involved to maybe have a re-education session with the patient, that would be good. Or at medical oncology or radiation oncology nurses, because we have these conversations with patients and caregivers all the time. So they're like, what if this has been done? Twice. Oh, too funny. I mean, we can't make people follow the recommendations, sadly. It's like beating a dead horse sometimes. It's like, as long as I have to tell my staff, we do our due diligence and we document it. But we can't, force people to follow their treatment plans or recommendations. Just all we can do is keep educating them at every patient contact. But I feel for you guys. That's a very tough situation because you want to protect them. You're welcome. I know that wasn't super helpful. I wish I had the magic answer to that one. We have so many uncompliant patients and caregivers. It's challenging.
One of the
Any?
things I know, I'm not quite sure if this applies to them, But we've been doing this a long time, and a lot of times when they're not following the directions, it's because of fear, uh, scared. They're scared, and they feel that maybe they're not going to get well. I remember, the reason why I say that because I think when I was diagnosed, all I could think about was the cancer instead of life. And here it is 25 years later. But I remember when I was diagnosed, you know, uh, I did what the doctors said, but I always kept thinking, I'm going to die. I'm going to die, And but I didn't. I didn't die. But so I'm not sure. Maybe it would be good just to suggest maybe she may want to talk to some people that's gone through this, that's going
Mhm.
through it. I mean, you know, I've run into some stubborn people, and they call me and I talk. I talk about life, not death. And, I don't sugarcoat anything. Oh, is there a group in Spanish? We'll find you one, baby.
Yes, we will.
We will find you one.
I
We.
and Zita, you bring up a good
Mhm.
point. Sometimes there's just a cultural barrier there.
Mhm.
If the information is presented to them in a different way, it kind of clicks at that point. I've seen that happen too. And Pam brought up a good point. Sometimes it could be fear. Sometimes, like she said, the patients could be, have a little bit of denial about their illness or even some depression, and they're gonna be like, "Oh gosh, what's the point of doing all these precautions?" Like Pam said, there's that fear of dying, and we got to instill in them that this is a disease that we most often catch super early and is curable. So we want to keep them healthy throughout that whole journey.
Do you all have bilingual navigators on your team?
I used to have one bilingual, but not now, but we have a pretty robust interpreter service that we use.
Okay.
So we do from time to time have one depending on our current staff.
Okay.
I know our medical oncology team, they have a couple of Spanish speaking clinic nurses, and those have been super helpful. Sometimes we can partner with them to do some difficult conversations that are just go better in person rather than, using the interpreter.
Okay, great. And then Zita, I want to make sure that website that Melissa shared, findhelp.org. Your question, is there a group in Spanish? Are you referring to a cancer support group in Spanish for your mother-in-law?
Yes. I'm
Okay.
I'm looking to. I just started, but I don't know if there's any.
How
Okay,
about a
so
how about an individual who's been diagnosed? You think that she would just speak with one person for right now? And, maybe she doesn't want to share all of that. Maybe if for
Yeah.
one person, I do have some Spanish sisters who've been diagnosed, and
mhm.
and they love me.
That's a great idea.
Yeah, I think that she would like that.
Okay, all right. Okay, I'm going to give you my number. I'm I'm not savvy, but I'm gonna give you my number here, okay?
Okay,
And
thank
give
you.
me a call. Give me a call and let's talk. And then we can pair her with someone who's come to me who was Spanish and who came through our program, who was diagnosed through our program, and I think she'll be very helpful. Okay,
Okay, thank you. I appreciate it.
you're
That's
welcome.
amazing. Zita, may I ask, where are you guys located?
Yeah, we're in Gainesville,
Oh, okay.
actually.
I think you
Oh,
told me that. That's right.
Yeah, so we're close and we're working with the navigator, trying to just go through all of this process. But thankfully she's been doing good with her medication and um all the paperwork that goes through with like insurance and disability and things like that.
Okay. I don't know which facility she's getting treatment at, but if it's ours, but if you guys ever run into any roadblocks or hurdles, please reach out. I will help get those barriers broken down for you guys.
Oh, thank you. I think right now the only barriers, the just trying to process everything with family.
Right.
Yeah,
Understood.
yeah. I think they're working with Stephanie.
Yep, Stephanie's our breast navigator. She's been doing this a few years now. She's amazing and she shares with patients too. Like her mom's gone down this journey and yeah, she's a great resource. I know in the neoadjuvant setting, which is where when patients have to have a chemotherapy prior to their mastectomy or lumpectomy, we're following them for quite a while. And then once they have the surgery and they go into like their endocrine treatment or something, we're not as hands-on with them. So just keep that in mind. If you guys need something in that setting, let us know. Because we're always there to help.
Thank you. Yeah, I think that they have been super helpful with her, and I think it's just like she might be facing a lot of fear
I'm sure.
a lot, I think a lot of denial because even when, they're encouraging her to go to appointments and things like that, I think and if somebody has to like be there or she will put things off.
Yeah.
I don't know.
My grandmother was like that. We had to drag her to the doctor's appointments. It's like, you've got to go.
Yeah. That I think that's the frustrating part as my family, my husband and his family are the primary caregivers. And so I think it's
Mhm.
just frustrating to hear that.
It is. It's frustrating and it's like, oh my gosh, I just want to be there to support my loved one, but they're not doing what we need them to do on their
Yes.
end.
Like
Yes.
they're the block,
Yes.
which
Yes.
is terrible because, they're probably experiencing so much, but we're just
Hmm.
trying to help.
Right. Yep.
And, and Zita, can I give you a suggestion?
Sure.
2 years ago, we lost my grandmother who was a cancer survivor, well, about a year and a half ago. And my mom and her 8 siblings, they were all caregivers. And then the grandkids, like myself, we were like the substitutes if one of the kids couldn't get there.
Mm-hmm.
And what we did is put together a binder of all of my grandmother's appointments and any notes. And so when each of her kids drove down to take her to her appointments and they were there for like a week at a time, they could just grab that binder and it would have, medications and, that information. So it helped her kids as caregivers kind of know what was going on and if there were questions because all of her doctors were not part of a group, they were all in individual practices. It helped us keep sanity.
Mhm.
And then it also helped them say, okay, mom, now this is what you're supposed to be doing. I know what you're saying that you want to do, but this is what you're supposed to be doing. And we had to pull that card on her several times.
Mm.
Like, no, the doctor said, this is what you need to be doing, not
Mhm.
that. I know you think you're grown, but this is what you're supposed to be doing. So hopefully that'll help too.
I love that idea. I'm gonna steal that one. I love
Go
having
for it.
the caretaker book. That's
Mm-hmm.
a great idea.
Yeah, we had it divided by heart doctors, oncology, all of her different ailments. So it was just a binder that was in her bedroom. It we had the dividers for, all of her doctors and to keep our things sane, to keep our minds sane, the most recent um, reports from the doctor went on top in that section, not at the back, but at the top of that section. So the most current was in the top. We had a section for prescriptions because my grandmother had a lot of prescriptions. There was a section with all of her doctors' names, contacts, and practice numbers. So.
And that, and gosh forbid it ever happens, but if you have an emergency and have to get out of the house quickly to take your loved one to the hospital, that's going to be a game changer, having all of that information right there and just easy to grab, especially the current medication list.
Yeah, and we had three instances like that where we had to call an ambulance. So, yeah. So hopefully that helps. But, and my dad was stubborn as well. He had prostate cancer. He had the hormone therapy and seeding surgery, and we kind of joked that it was hormone therapy. And again, he didn't want to do certain things. And I said, "Do you want me to go to the doctor with you again?" And he was like, "No." I said, "Well, you're going to do what the doctor said that you're supposed to be doing. And we're not, or I'm moving in and I'm sleeping right in the
Mm-hmm.
bed with you."
Yep, yep.
So, th that kind of worked with my dad, but you all have to find the right thing, the right thing that's going to work
Mhm.
with your mother-in-law.
Yeah. I think it's so new for her too. Like it was
Hmm.
just discovered in January and
Oh,
it's one
yeah.
of these types of diagnoses that unfortunately it's the doctors are saying that it's a life expectancy and so there is no like cure. There's only just delaying it. So I think that's hard too. So I think we're just all she's very new to this and processing it and together as a family the same thing.
For
Okay.
sure. What stage is her cancer, do you know, Zeta?
Yes. So final stage.
Okay.
Yeah.
Okay. Gotcha.
But yeah,
That's
so we're not even like she's not even doing chemo or radiation or anything. She's just doing hormone therapy because that's not the best option for her.
got you. Has she been connected with our social work team?
Oh yeah.
Okay.
Yeah.
Perfect. Yeah,
It was
they're such great resources and especially, helping to counsel them when it's just a difficult diagnosis too, and they've been helpful with family members as well.
Yeah, I actually was appreciative that I learned that the social worker could maybe help have conversations with my
Hmm.
mom-in-law because she also helps to take care of our niece. And so like,
Yeah.
our niece is 5, so she doesn't know what's going on. So that could be a conversation for the future.
Absolutely. And I should have those books I was speaking of earlier in the conversation within the next week or so. That might be a good one to pass on to the family as well.
Oh yeah, like if you want to
Hmm.
give it to Stephanie, I'm sure we'll get it.
Yeah. And I'll share some with Pam too. That way, she has the resource for the other participants who couldn't join tonight.
That would be great. Thank you so much.
Absolutely. Thank you for joining and asking your questions. This has been great.
And Miss Pam shared her phone number in the chat. And I know that some of the resources shared tonight, I did put the links in the chat. You can save that chat, but I will make sure that I include that in the recap email tomorrow or Monday at the latest. But does anyone have any other questions for Melissa?
And Terry, if you need me to send any of the resources I kind of brought up, I'm happy to. Just let me know.
Yes, if you could, that would be great.
I'm stealing Miss Pam's cell phone while I can too.
Oh, perfect. Miss Pam, you're muted.
I think everybody that's on here tonight has my personal cell phone number, so it's okay. You know, they do. They call and they say, well, when they do call and we talk, and they say, well, I was supposed to call you.
Hmm.
You made me feel better. We never know. You know, I'm just glad to be a servant. That's all, to help them get through it, because I know, uh, being newly diagnosed, how that makes you feel. So, but I'm here. I cry one time with you. After that, we fight. That's it. We fight after that.
I love it.
Well, great. Well, does anyone have any other questions before we close out?
And I'll share my contact information with Terry too, and you guys feel free to reach out if you have questions, that come up later.
Perfect. Thank you so much for doing this, Melissa. I mean, you have
Absolutely.
opened my eyes on this entire process. So if anyone has any questions afterwards, we'll make sure that you get Melissa's information. And you have Miss Pam's if you have any other questions. So thank you so much. Perfect. Okay, I'm just making sure. All right, thank you.
Thank you
Oh,
all.
thank
Thank
you.
you.
Have a good evening.
You too. Bye bye.
Okay, thanks.
Hope to
Bye.
see you next month.
Bye-bye.